For children who are aged 5 and above, it's a bit different when they come into the clinic. This can also apply for slightly younger children or slightly older children. Children are usually used to taking instructions from other adults because they have been in situations where that happens, like in school, nursery, or in any clubs that they go to. When they go into these places, they usually know that you trust the person that you're taking them to look after them, and they will listen to their instructions. That's why when you come into Sunrise Dental Clinic, your responsibilities stop there in terms of getting your child to do what we need them to do. It's the clinician's job to interact with your child, to bond with them, and to make sure that they get them to do what they need to do to be able to have a really good, comprehensive assessment. Pediatric dentists have behavioural management skills, and they're able to interact with children in different ways and try different methods to be able to get them to feel comfortable and allow good examinations and treatment. You can facilitate this by taking a step back and allowing your clinician to do their job. This sends the signal to your child that you are completely at ease and you trust us and they are safe. When your child comes in for their first visit, if they need to, they can come into the disco room and brush their teeth, which is always a fun and exciting adventure. We have lots of different toothpaste flavours for them to try in the disco room. Then when they come into the surgery, the first thing they'll do is they'll select some sunglasses and a superhero cape. The superhero cape is just to break the ice. It's not really necessary in the first visit, but it's an exciting thing to wear. We'll take them through and take a picture of them in the dental setting where they'll be sitting for their treatment. This sends home the message to them that they can be in that place and be happy because they'll be smiling in that picture, and they'll take that picture home and remember that moment. Once we've taken a picture, broken the ice, we will put something on the TV to help them feel at home and to distract them while we do our thorough examination. A thorough examination takes into account how their jaws are biting together, how their lips sit, their facial profile, their jaw joint, and lots of other factors that the dentist will be looking at without you even realizing. And of course, we'll assess each tooth by tooth, to see if there are any issues. Usually x-rays will need to be taken. This will help us to see anything going on in between the teeth, but also any dental anomalies like missing teeth or extra teeth growing in the jaw, or things just growing in the wrong direction. All of these bits of information will be put together and a plan can be made for your child. This plan can be discussed in front of your child if we both feel that this is appropriate. If we don't feel it's appropriate, your child will be in the clinical area with the nurse who will do some acclimatization through play, which is playing with the water, playing with the suction, and allowing them to ask any questions they have about the dental chair. While your child is doing this lovely interaction and getting their goodie bag from the nurse, which will contain the sugar bug poo story, the leaflet which will explain everything they need to know about dental health, during that time, your clinician, myself, or anybody else from the Sunrise team will be going through a treatment plan for you and your child. The treatment plan will be discussed, the estimate will be generated, and you'll be informed of any upcoming costs. If you have any questions, you're welcome to ask at this point. Once we've finished this step, we'll also talk through the plans available that might suit your child. Once we have made a plan going forward of what we need to do for the next step, we will bring your child back into the conversation, give them any pieces of information they need about upcoming appointments, what to expect, and remember, you don't have to tell them anything. Your clinician will prepare them step by step for each visit. If your child does ask you questions outside of the appointment, remember, you're not a dentist, you don't know what the dentist is going to do, and they can inform your child what is going to happen. This takes the pressure off you as well as a parent. At this point, we'll take another photo of your child to put up on the wall to join all the other children in the Sunrise Dental community. Your child will then be allowed to choose a prize from the treasure chest. The treasure chest is for every child who does great listening during their appointments at Sunrise. It's very rare, but on occasions, if we have a lack of cooperation and we know that it's not due to any anxiety, rather due to behavioural issues, we might use the technique of not giving a prize as a method of not positively reinforcing negative behaviour. This happens very rarely and it would be discussed with you in the appointment. However, it's a very good tactic to stop encouraging the behaviours that we don't want in the dental clinic and encourage the behaviours that we do. So the positive reinforcement of having a prize when you've done great listening and achieved something great is fantastic. And the children like the sentimental value of the gifts that they receive from Sunrise Dental Clinic. If you have any questions at any point during the appointment, please feel free to ask. Equally, if you want to discuss things away from your child, please say so. And if you want things discussed in front of your child, also say so. We want you to be involved with how much involvement they have, but we also would like you to put your trust in our expertise of when is appropriate to say things to children and when isn't. Remember, it's just like when you're driving. Your child doesn't need to know all the details of how to drive. They sit back, relax, and trust you. It's the same with the dentist. The dentist is a person who should be trusted by your child and yourself. Finally, you can make any appointments that you require, and you can buy any products that you require based on the recommendations of your dentist and based on your child's enamel needs. Look forward to welcoming you to Sunrise Dental Clinic. The first appointment is always a fun one, and everybody leaves wanting to come back.